I think the biggest challenge in MPN is the presence of extramedullary hematopoiesis. So this is abnormal blood cells growing in liver, spleen, lungs. So these organs are affected and they are impaired, and they do increase transplant-related morbidity and mortality. So MDS has a lower transplant-related mortality compared to myelofibrosis simply because of this reason. And so that's the first challenge, to reduce that non-relapse mortality. Second, again, is the same thing. The spleen is very big. So it, if you will, acts as a sink for the new cells that go in. So it results in increased graft failure rate. It results in poor graft function that we see after transplant. So I think spleen needs to be addressed. And the third big issue is, because of big spleen, there is portal vein thrombosis, portal hypertension, so risk of bleeding varices. So that's, again, is another major issue, and that needs to be taken care of in many of the patients. And lastly, some patients do have pulmonary hypertension, and again, that increases the risk as well. So these are some of the challenges, but I think slowly and steadily we are overcoming those.